Welcome back to the Blueberry Pediatric Podcast. Today, we are joined by a return guest and someone I genuinely love having this conversation with, Dr. Ashley Lerman. Ashley is a pediatric dentist, a mom, and the founder of First Grin, a platform built to help parents feel more confident caring for their child's oral health from the very beginning. If you've spent any time online, you may already know Ashley as at pediatric.dentist.mom, where she has a rare ability to make dental care feel practical, accessible, and far less intimidating for families. Her work is rooted in a simple but powerful reality. Cavities are still the most common chronic disease in children, and parents deserve better tools, clearer guidance, and less fear when it comes to prevention. Ashley created First Grin out of what she was seeing every day in her practice. Parents who wanted to do the right thing, but felt overwhelmed, unsure where to start, or afraid of making the wrong call. First Grin is built to meet parents where they are, whether that's pregnancy, teething, first dental visits, races down the road, or handling the unexpected, because there's always unexpected. What I appreciate most about your work, Ashley, is that First Grin isn't about perfection. It's about access, clarity, and confidence, and recognizing that oral health is deeply connected to the overall child health. You've also been very intentional about making this information accessible to everyone, so caregivers, partners, families, employees, because equity in healthcare means getting everyone in to participate. So welcome to the show again. I'd love to focus on your expertise and the work you're doing through First Grin, why you built it, how parents are using it. Why don't we start there?
Thank you so much for having me back. Amazing intro. I'm really, really proud to talk to you again. I love what you guys are doing at Blueberry, and it goes hand in hand with access to care. A little bit about my background. Like you mentioned, so I'm a board certified pediatric dentist. And I started First Grin basically after my first job in residency, where I was seeing 80 to 100 patients a day, 10-hour days, just massive
Whoa.
need. And just a major pain point came out. And parents were like, no one told me how to take care of my kids' teeth. I thought I was traumatizing them by holding them down to toothbrush. I
Right.
saw bleeding on brushing, and I just wanted to get this information to families early, plug it into the broader medical system, and that was really just like the inception point of the company.
That's great. It seems like almost obvious, but the fact that you see so many that don't have that access, like clearly we have a biased perspective because we're so focused on healthcare. And then the implementations that you help them to make are pretty easy for them to do day to day. Do you want to talk about what those are?
Yeah, and I think you're right. Like it seems so obvious to the point where people don't mention it or talk about it or get a little specific in the beginning at the right time. And so much of this is timing. And yeah, I guess the general idea to take home in the practical way is you start brushing as soon as that first baby tooth comes in because it is so important to get that routine in early. It makes it easier for caregiver, makes it easier for child. And again, it sets that routine early on for down the line.
Yeah. It's funny because when I think about what I do with my kids, how it has not changed from what I learned when I was a kid. Even the way I brush my own teeth, like it's the same routine. You don't pay attention to it, but like pay attention to it and then not you, like everyone watching, and you'll realize you follow the same pattern, you do the same things, and like perhaps that means that if you're doing the same thing and missing something, it's regularly being missed. So yes, it's obviously so important that we get in early, and it's not like every parent knows automatically how to help their kids because it changes with age and it becomes more difficult or easier with age. Um, so it's you're sending kits, is that right?
Yeah, so the way First Grin works is we basically send out oral care kits based on age. So starting actually during pregnancy, they blew up on the baby shower gift registry for whatever reason, which is really cool because it's a practical, useful, educational gift that you'll actually use.
Right.
It includes a year of the app, which is an oral care companion app, and you win free product and it's tips, tricks. Like
Wait, I'm gonna
I'm so
pause you there because it's like
yeah,
there are so many things on like for baby showers that you buy
yeah.
babies that it's like so extra like like a
Yes.
baby wipe warmer that you're gonna use for like 5 minutes, maybe decide it like is not worth your time or the effort because like who needs that? But and then there's like a kit that's gonna help them forever and ever and you're gonna use. It's like just so genius. Sorry, go ahead.
No, I love that. And there isn't anything like it, which is the most important thing to me because it's getting the education at the right timing. Like everything's timing. And as soon as that first tooth comes in, parents are like, oh, I got this gift on the baby registry. Let me turn to, and they open it up and really learn how to use the objects. So the goal is to like meet the individual, the consumer, whatever you want to call them at home. So you could teach them at home really where habits are built.
Yeah, great. And so this also you help guide them through like dental emergencies, right? Is that what part of the the service does? Which I'd love to talk about, like just little tips and tricks about like what's emergent, what's not, like things that are very scary, like a broken tooth to a parent. Can we walk through like what the most common things are?
Totally. So on the Oral Care Companion app, there is that digital trauma guide, and we see this all the time with toddlers specifically, as well as sports age children. So we broke it down with clear visuals on baby teeth and adult teeth. Most commonly, I'd say with the baby teeth is an avulsed tooth, aka the tooth flew out of the mouth. That can be really scary as a parent. The mouth's bleeding, everything's going on, your child's screaming. You don't even have a dentist to call because you haven't seen one yet. We see that all the time. So the goal is
Wait, so
a
do these people normally go to the emergency room? And then like what happens
yes.
then? Because like what's the
So
alternative is to like knowing what to do? Like they're gonna go do emergency room and then what happens?
that's exactly right. They'll go to the emergency room, and we know what that looks like. It's a lot of time, a lot of stress, a lot of money. So the guide is supposed to help divert that, connect you to the right resources. So with a baby tooth coming out, your rule of thumb is you never put in a baby tooth back into the mouth. You can damage the adult tooth. B, it can come out, be a choking hazard. So you keep the baby tooth out. You do want to keep it so the dentist can take a look at it when you do get that follow up. So you can keep it in a cup of milk, a little plastic baggie. If you're unsure, just want to be overly cautious.
This is a board question in pediatrics, by the way. Like, how do you
Oh, I love
maintain
that.
it? Yeah, it's ridiculous. Like milk, I don't know, I kinda remember this.
I remember on our boards, we had to rate what the best solution versus worst solution to put and save a baby tooth in. And one of them was like Gatorade, saliva, milk. It was bizarre, but yes, also stands out as a board
Okay,
question.
wait, I'm gonna try and I'm gonna say saliva over milk.
Correct. Saliva is actually the best.
Okay,
Saliva
yeah,
is
because
the
I figured
best.
it's natural, right? Okay.
Yes. Yeah, you nailed it.
Okay, saliva, milk, Gatorade's probably lower down.
Yeah, pretty low, pretty low. Also, I want to add to that. This is obviously a distinction, but we see it all the time with sports age kids. But if the adult tooth flies out, that's a medical emergency. You do want to see a dentist right away. Go to the emergency room where there's a dental department, ideally, because they want to get it back into the socket again, ideally within 60 minutes, because you can extend the lifespan of a tooth, this whole thing. So, just something really important to note.
Yeah, that's great. Big distinction, baby tooth versus
Yes.
adult tooth. So adult tooth, real emergency, let's get it back in and handled
Yes.
properly immediately. Yeah, got you. So my kid actually was like holding herself up between like two chairs and then just decided to like face plunge into the ground, smash her front teeth. Baby teeth, but they moved. They were moving, and it was like way before she was ready to lose them. So I was actually quite interested at the management for this. Do you want to talk about what you usually recommend for that? Because I'm sure that I'm not the only parent who goes through this.
Oh, all the time. My own toddler son, when he was learning to walk, smashed his face consistently and made his teeth loose. So the biggest thing with loose teeth after a toddler incident is you want to make sure that they could still bite, still eat within reason. As long as they can, it's managed with a soft food diet. You could do some ibuprofen or Tylenol. Nothing too hot, nothing too spicy because it tends to resolve and get better. The teeth can actually get less mobile with time. However, if they're really loose and they're occluding or biting improperly, it's worth getting checked out by a dentist because they'll probably take an x-ray. It's not really something that's often repositioned. It might be something that's recommended to be extracted, but definitely needs a clinical exam if they're not eating normally.
Okay. And so the thought is that they can strengthen back and not be as shaky?
Yeah, so the teeth are locked in by a little ligament called the periodontal ligament, and it can tighten up after a time after some trauma.
Yeah, so that's like we think what happened, and then she hit it again, and then again and again. It was like, "How are you kidding? How many times?" But anyway, they did solidify enough to finally, like, stay in until they needed to fall out, and I always question if they still came out early, but whatever. She looks it was, like, normal-ish enough time.
Perfect.
But I think, like, one of the things you said before, especially from a medical standpoint, is that if they're loose or there's risk of them coming out, you use the word aspiration, but that's when they could accidentally like inhale it into their lungs, their breathing tubes
Yeah,
higher up. So that's what we worry about as being is like turning into a really really bad emergency that can be prevented by having that evaluation to make sure that's not what could happen.
right.
Yeah. All right. So, um What do you think like causes the most concern and anxiety around dental care? And maybe that's like at home as to what could happen, but also like when they go to a dentist.
Oh my gosh, it's such a big question because we have parents come in who have their own dental anxieties and have had a lot of trauma when they were children, being held down for teeth being taken out, those types of things. And care has changed a lot since that. But often parental anxieties can project onto children. So making sure parents are on board with the child, using the right language. I always say before a first dental visit, which can evoke a lot of anxiety, watching a YouTube video, reading a book, and having a script for what to expect. I know with my pediatrician, my son was really nervous about the stethoscope. So our pediatrician said, go on Amazon and get this little playset. And it honestly helps a lot, I
Yeah.
guess. Like, every child's going to be different, but with everything, desensitization, exposure, that often helps. So I'd say first dental visit, a big source of anxiety. I'd say another source of anxiety in the grand scheme is for some reason like crowding with the baby teeth. They want to see if they can avoid braces, these types of things, and getting into their child's routine early for what they can control, though a lot of it is predisposed genetically.
Yeah, makes sense. So when is the first dental exam recommended? Let's make sure everybody knows this.
Yeah, so first dental visit is recommended by age 1 or 6 months within that first baby tooth coming in.
Okay. And so I will tell you, like as a pediatrician, we might not always say that, but now after having kids, I like very much am on board with this because, and it seems like 1 year olds like they got nothing going on, but it like really, especially if it's your first kid, it sets you up as a parent to understand how to give that proper dental care, and it gets them used to going so they're not scared. I literally took all three kids of mine yesterday to the dentist, and I get them off the bus right into my car because I need to get to them like right away after school. And literally they knew it was coming, but they forgot. And they're like slowly, slowly off the bus. Then they see me standing by the door. And my two big ones, my third little one was already strapped in the car, literally were like, came sprinting into my car, excited to go to the dentist. And I was like, oh my God, like they're like, first of all, my dentist is doing something very right, but also like pat on the back for a mommy who like had to work really hard to get to this point. So like every parent, you're not alone when you're going through this, but like it shouldn't be it's not really a bad experience. A lot of pediatric dentists know how to handle kids so well. Helps if there's distraction, if you need to bring a little something, definitely motivation and like a positive reinforcement at the end. And usually dentist office are like pro and do that anyway. Give out gifts, whatever. Try to avoid the candy, but like still we know like the offices are still like
Of
where they're
course.
expecting that lollipop after. Um, but now there's what Zollipops with the like that instead of the
Yes,
sugar.
those are really popular.
Yeah.
And I will say two things that you kind of alluded to. The first is that when you tell parents to go in by age 1, a lot of the times they're like, does it really matter? Baby teeth don't matter. And like you said, it's the behavior, the habit, the routine early on. And also having that dental home. So if they do have toddler trauma, you know who
Right.
to call, you know where to go, rather than starting off scratch, going to a dentist visit when your child's upset from hitting their tooth. We see that all the time. Um, yeah,
Yeah, I mean, I always have questions about how to handle their teeth, and like, I mean, it's very frustrating that my kids won't even floss well or a lot or sometimes at all. And I really, just like parent advice here, I can always be like, well, Dr. Kimmy's going to be very upset with you. And they're like, oh, that can't happen. We have to fix this. We're going to do it.
totally. And I think people assume for a very wrong reason that my kids like brushing their teeth. They don't. I'm still doing like the baby jail. They're laying on the floor. I'm doing it for
Oh,
them.
yeah.
And it's grounding. It's humbling for me because I have to be creative in ways to talk to other parents, but it's just validating and realistic that this is part of the process. You're not traumatizing your child by brushing their teeth. I get that question a lot. It's again like the behavior psychology behind it, positive reinforcement, routine, that kind of thing.
Yeah. I have like I think two recommendations. You probably have more of like those TV shows or little clips that you can find on YouTube that are really good for showing them and getting them excited either about the dentist or just brushing. I think Daniel Tiger has something,
So
and
good.
then yeah, and then I think Elmo has a bit he does. So if you just search for those like Elmo brushing teeth or Daniel Tiger brushing teeth, you could find those. Do you have any others that you know offhand?
Those are, like, my top 2. I would say there was a really good Curious George one too, and it goes into it's more of a longer episode, but talking about sugar bugs and the visualization, like, my son was really into it. He's 2.5 now, so starting to put it together, but I really like those 3.
Okay, that's another good one. I'll check that out too. Is there literature out there about like the change that it actually makes and the impact by having the either education earlier on or the dentist or the regular checkups?
Yeah, so actually, the study just came out this year that parents who have quote unquote poor oral health literacy or don't really understand what to do at home are 5 times more likely to have kids who have poor oral health. So it really comes down to the caregiver's understanding of what to do at home that influences their child's oral health down the line. There is also data on maternal oral health status and child's oral health status. So if mom has current cavities, their child's more likely to have cavities as well, just because of bacterial transmission through saliva, which we found is very, very common early on, whether that's from kissing on the mouth in a cultural way, whatever it may be, sharing utensils, those kinds of things. We also know that cavities in baby teeth are correlated with cavities in the adult teeth. So baby teeth really do set the stage for adult oral health. And people have this disconnect that baby teeth don't matter, they just fall out. But there's this period of time, like between 8 and 13 years old, where we have both baby and adult teeth in the mouth. So if you have baby teeth with cavities, that bad bacteria can spread to those adult teeth as well. So it's really shifting the conversation to realize that we have a lot of influence and the habits at home can really, really help.
All right, I'm gonna hit you with some like common questions that I mean
Okay.
just like on my mind. Okay. Start with a heavier one. Fluoride.
Okay. Yes, pro fluoride,
Yes,
gold standard stuff.
done.
Just blanket statement, yes. Pro fluoride, it's in the news a lot recently, but it is the gold standard, one of the best and most effective way to prevent cavities, especially for kids who have low access to care. But if you're high risk, and a lot of us are, high risk can include having more than 3 snacks a day. Like, I know my kids are eating more than 3 snacks a day. So, fluoride's a great tool in your belt to help prevent cavities in their teeth.
Okay, great. And usually it's in the drinking water, but everyone should check. Like where I live, it happens to not be, so that there are supplements that are then recommended. But I think usually it is, right?
Yeah, that's exactly right. So, fluoride in toothpaste works differently than fluoride in the water. If you don't have fluoride in the water, talk to your pediatrician, pediatric dentist, talking about supplementation.
Okay, and this has been hot topic. It like kind of fell out of the news cycle, but was very heavily in the news cycle with RFK. So,
Yeah.
um, I mean, I think the what's been in contention is that we know super high levels of fluoride is not good, but that's not what we're getting in our water sources or the recommended like vitamin if you don't have it in there in your water.
Yeah, it just comes down to this concept of dose, like poison is in the dose is in the poison kind of thing, where there are recommendations for a reason. We're recommending a very strict and stringent level of fluoride. And all of the studies that have come out about excess fluoride haven't happened in the United States. They've happened in areas where fluoride naturally occurs at much, much higher levels. Again, that doesn't happen in the United States.
Okay. What about sealants? I think for the older, like sort of older kids.
Yeah, so a sealant is basically like a painting and protective covering on the 6-year or 12-year molars. It's painted onto the grooves of the teeth to make sure food doesn't get caught in the teeth as easily, helps clean them easier. They're one of the best, most data supported ways to help protect the teeth, so very pro sealant.
Okay, great. When is it in general the best time to see an orthodontist?
So guidelines say age 7 for the first orthodontist visit, going to depend individually on a child based on their dental development.
Okay, great. What's the best way you recommend holding a kid who hates brushing, but you need to get in there? So a young one.
So I do this every night. I lay my child in front of me. His head is between my legs, and my legs are over his arms. So he's making a big T on the floor, and my legs are over his arms.
So like
I'm using,
your knees are on the shoulder.
yes, exactly. That's
Yeah.
exactly right.
Okay. Yeah. So like the arms can't start reaching in to stab you.
It's really hard to be efficient when their hands are grabbing you. And if I try to do it with my son standing up in front of me, he grabs and I can't get the back teeth. And that's really common. And that's often where I see those problems
Yeah.
where
Okay.
cavities
Gotcha.
start. So, yeah, laying on the floor, I use one hand to go all the way on the gum pad to help open the mouth and the other hand to brush. And I just get in there really efficiently every surface of the tooth. I let him up, give him a turn, and then praise him. Like rinse and repeat. That's the format.
Okay. Did he get used to it where he's not struggling?
Depends on the day.
Yeah.
He depends on the day.
Yeah. Gotcha. Okay. Brushing in the morning for little kids. Mandatory
Yes,
or not?
ideally twice a day. I mean, like,
Okay.
listen, do what you can. I'm all about progress over perfection. Parenthood, as it's hard as it is. Do your best. I would say if you had to pick morning or night, aim for night because you don't want anything sitting on the teeth overnight. But, I hear this all the time and I get it. I'm not going to shame you, guilty, whatever. Aim for two, but do your best.
Okay, great. And then I guess flossing, I guess optimal is every day, but if you're and then you prioritize like the teeth that are close, but like any tips there?
Yeah, so this is gonna be one of those things where I use that position. Both of my kids' teeth came in touching, they don't have space, so when they're talking to me, I see, like, shards of broccoli in there, and it drives me nuts. So, I swear by floss pickers, they're so much easier than string floss. Aim to do it every day, but as soon as you see teeth touching, that's when you wanna floss. It's not age dependent, no age recommendation.
Okay, perfect. Trying to think what else. What did I miss that like you get all the time?
I think those are good. Like, a little bit of a hot button topic is, like, the tongue tie. I don't know if you wanna talk about it, but it's
Yeah,
basically,
no,
like,
I
look up
would
to you.
love to. What are the
Okay.
recommendations from your perspective? And I'll give a little background information. So tongue tie is usually what's diagnosed or found or identified when a baby is trying to breastfeed or feed in general from a nipple, and it's just the muscle underneath. There's more than one muscle is tight, not allowing for the proper motion in order to transfer milk into the mouth and swallow it properly. So yeah,
Yeah.
you want to take it from there?
Yeah, so we get asked about tongue ties and lip ties all the time. I would say it's so individual based on form and function. That means, yeah, what your tongue looks like, but also is any function being impeded? Like you said, with feeding, with lactation, that's something where we'll intervene. And it doesn't necessarily mean you need to get a revision or the tongue tie cut. It could include myofunctional therapy, things like that, stretches, whatever it may be. There's a range of intervention. And again, it's a hot button topic, but it really depends on the individual and what the goals are too.
Yeah, and what you've trialed, what hasn't worked, and then usually done in conjunction with lactation. I'm assuming they're like coming
Yep.
to you once that's already been done.
Exactly.
Okay. All right, that's tongue ties. Actually, a great one is grinding. Little kids, I mean, I can hear my kids grinding from their room into
Yeah.
mine, and it drives me insane. I've been to, so I know what I've been told, but I'm very curious what you tell your patients, parents.
Yeah. So grinding, I feel like it ties into this conversation of sleep and airway. They do go hand in hand. It's something that should be looked at and noted when you go into the dentist. Mention it so we could put it in our note and follow it. It really depends. Maybe we'll make a referral to ENT to look at the airway, but it can be just a transitional time where kids grow out of it, and we see that often too. So it's not it's not necessarily indicative of something wrong.
Okay. So, like, we kind of can just leave it for now.
Yes, I tend to be very conservative when it comes to
Yeah.
those things, and yeah, with parents, I often remind them that they tend to grow out of it.
Okay. Great. Mouth breathing. This is a hot topic too. Thoughts on that?
Yeah, so mouth breathing. So when we talk about mouth breathing in dentistry, something that we talk about is saliva in the mouth because saliva is protective in the mouth and prevents against cavities. So if you do have dry mouth, you can have a higher risk of cavities. With kids, we can see mouth breathing due to a variety of reasons. One can be allergies, one can be getting over a cold, things like that. One thing I want to point out is you never want to mouth tape a child. I've seen that come up, and that is just dangerous. Just don't do
Great.
that, please. Yes, you can mention mouth breathing to your dentist, maybe something they talk to the orthodontist about down the line, and look at the airway, but don't mouth tape your child.
Yes, agree. There was a slew of those videos that were horrifying to
Yes.
me. It's like
Yeah,
suffocating your kid. All
exactly.
right. All right. Anything else that we missed, do you think? I mean, this was so helpful in terms of like little things to know and the preventive care start from the beginning.
I think we covered most slash a lot, and if anyone has feedback and coming forward, we could do like a second part or whatever.
A third part.
A third part. You're right.
Yeah.
Good point.
All right. Well, thank you so much for joining me, Ashley. This was so helpful and fun as always. I'm going to just drop your handle again at pediatric.dentist.mom. If anyone has questions, pediatricians are always available too, if needed through Blueberry. And dentists are always such wonderful resources. So feel free to reach out on either side.
Thank you so much for having me. This was so fun.